Thank you so much for the opportunity to present our research today on stressors, coping, and meaning making among parents of children with severe neurological impairment. I'm fortunate to work with an incredible multidisciplinary research team, and today I'm presenting our preliminary findings on our team's behalf. Children with SNI or severe neurologic impairment have either static or progressive central nervous system conditions that result in both motor and cognitive impairment, as well as medical complexity. Although children with SNI make up less than 1% of the pediatric population in the US, they account for about a quarter of all hospital bed days and nearly a third of costs at pediatric centers. Parents and family caregivers of children with SNI face many psychosocial challenges, particularly during these times of hospitalization and especially in the ICU during their child's serious illness. The objectives of this study were to examine these challenging experiences and the ways parents integrate these experiences as a part of coping. Our methods included a supplemental sub-analysis of qualitative data from a single-center study in the US. Eligible parents and family caregivers had a child with their SNI condition for at least 3 months and were admitted to the ICU for over 24 hours with an expected long length of stay of at least a week. Participants completed one-on-one semi-structured 60-minute interviews at the time of their ICU discharge that queried 2 domains. The first was stressors, and the second was integration of these experiences. Parents also completed a brief demographic survey on REDCap. Audio recordings were professionally transcribed, and data were analyzed into themes by our team that included pediatric palliative care, intensive care, child psychology, and qualitative research experts using inductive thematic analysis. In total, 15 caregivers of 15 unique individual children with SNI have participated in our study to date. 30% were from various racial and ethnic minority groups, and about 13% identified as fathers. 73% of the children in our study had congenital or chromosomal diagnoses, and all used some kind of technology assistance. Themes regarding stress included near-death events, health setbacks and changes in baseline health, vigilance around specific care needs, and not feeling heard or listened to as a parent. One parent shared, "It is beyond exhausting. It takes me days when we leave the hospital to even attempt to emotionally recoup from it, and it feels like an unending just wave after wave, and there's an exhaustion level that is not something that I've ever experienced in any other way. It's just the reality of having a medically complex child, that you know all of their information and they can't advocate for themselves." In terms of themes regarding coping, 2 sub-themes emerged. One was being included, and the second was receiving care from compassionate clinicians. One parent shared, "This is the only parenthood I know, so I don't know that I've changed, because she's always had health concerns, and she was born with these health concerns. But it's definitely changed me as a person. I think it's made me a little more fierce, a lot smarter, a lot stronger. It's also made me a lot more passionate about human rights and equality. It's made me have more gratitude, and it's made me really tired." Finally, themes regarding meaning making included gratitude for the value of life and family, and appreciation of health and well-being. One parent shared with us, "I think you feel like there is an impending grief that will hit all of our lives with her, like there is going to be a collective wound when we end up losing her. And I hope that we've done a good job working through the emotional pieces of that with our kids, anticipating and just embracing every day. I don't know if that fully describes it, but it has changed the way that I process it for sure." Notably, this study has a number of limitations. First, it was a single-center study with a small sample size, limiting generalizability. We interviewed parents in the ICU context, also limiting broader understanding of their lives and needs in other hospital and home settings. Finally, our analysis and research team primarily consisted of various healthcare workers, and therefore offers a limited lens and viewpoint of these data. In conclusion, although traumatic experiences are likely to persist among parents of children with SNI in the ICU, this study suggests that finding ways to encourage integration of these stressors and opportunities for parents to feel listened and heard may be important areas for future intervention research. Thank you so very much.
Thank you so much for that. We have a question. What thoughts, insights do you have from this study about the ways we might improve supportive care for these parents?
Yeah, thank you so much for that really important question. I think that's fundamentally what we're trying to get after in our research group, and I know other people working in this space. I think the thing that we're hearing most important to parents in this community, especially in the hospital setting where people may be less familiar with their child and their specific care needs, are tools around advocacy. Because parents feel the repetitiveness of having to share their story and really speak to their child's quality of life over and over again where stigma exists. And so one thing that we are working on are photo narratives, ways of quickly enabling parents to share what's important and more about the home care setting and their child's quality of life with clinicians in a fashion that we think again enables them to tell their story and enables clinicians to potentially download that information quickly. So stay tuned. Obviously, that's just one avenue. I think parent social support, in addition, is really important, as well as more structural support.
I certainly wonder how much there was the theme of parents having to fight for care and for their child on a continual basis. Did that come over?
Yes, very much so. And this is a population of children and parents that I've worked among for many years, and I think that rings really true. We have such a problem-focused or problem-oriented healthcare system, and I think what we're learning more and more are for children with chronic medical complexity. It's also important to tell the stories in the medical system about what should be celebrated and what's going well. So hopefully that can help with some of the stigma that exists.
We've got another question come through, if I may. Do you have any recommendations for how to encourage folks to find meaning without minimizing their suffering by asking them to help find the silver lining?
Oh, I love that question so very much, because I think one of the challenges in this space is not, by uplifting the meaning making, coping, gratitude that is happening by necessity among many of these parents. I think it's really important not to sort of devalue or underemphasize how hard it is. There's a lot of resources, including a video that recently came out, a documentary around parents' challenges in this space. And so happy if people want to reach out for more resources, but absolutely, I think it's a balance.
I think your idea of photos are wonderful. I remember one family, they showed the child doing an abseiling course, and the doctors and nurses were completely shocked, and that made an enormous change to what they were doing for their care.
Yeah, absolutely. We only know our own experiences and our, medical training or training within the healthcare system. And there's so much more to these children's and families' lives that we need to integrate.
Thank you very much indeed for your presentation.
Thank you.